Insurance is probably a logical question and how they pay for these procedures. Obviously, we have amazing financing options to make it really palatable with a monthly budget. Because we've got a mix of people that have cataracts and some don't. It's really what the next step for a lot of us is to have that conversation where we can be able to find out where you're at, and obviously we want to help if you have anything that can be covered by insurance, so you can be able to do so. But any other thoughts you want to tack on to what I just said, please?
Sure. So our workup and evaluation, whether you're getting a refractive lens exchange or cataract surgery, is exactly the same because we always try to see if you're going to qualify for insurance to cover the cataract surgery or the lens replacement. Obviously, that's financially advantageous for all of our patients. So we always try to see if they're going to make the criteria for insurance to cover it. If you don't meet the criteria, we'll tell you if you're close to meeting the criteria. But if you're not close to meeting the criteria, then it would become a refractive lens exchange, which is not covered by insurance. It's basically the equivalent of LASIK, where LASIK is not covered by insurance because it's considered cosmetic, since the main purpose at that point is just to get out of glasses. When you do have what we call a visually significant cataract, that means you met the insurance criteria for removing the lens, then we have to reach out to your insurance to see what portion that they cover. We have a great billing team that will get all the information so that we can provide all of that information to you up front. And insurance, we know, is very complex, very confusing, and very frustrating. It is on our side as well. And so we try to make it as easy as possible. And that's one of the major benefits of having the surgical facility on in our clinic, is that there's just one bill. Like if anybody's ever had a surgery done in a outpatient surgery center or in the hospital, that is sometimes scary because you'll get these huge bills afterwards, and it's really hard to get that information up front. We have complete control over the entire process, except for the part that insurance controls, so that we really try to be transparent with all our patients, get all the information up close so there's no surprises. Insurance always tells us that it's not a guarantee when we get the cost estimate from them. But having worked with the insurance companies and knowing their patterns with a lot of other patients, we can kind of tell our patients, like, this is what we anticipate with the procedures. Now, with both, if insurance is covering the surgery, which it does not cover any upgrades in the lenses, it just covers the basic lens implant. We will also tell you if you want, what the vision outcome will be and how dependent you'll be on glasses with each type of lens, so you can kind of figure out what the best lens is for your budget. As Michael alluded to, we partner with a really great financing partner that allows us to provide financing for our patients with no interest over 24 months. So the payment with like the most upgraded lens would be less than $500 per month, which is really nice versus having to finance and pay interest, which can be challenging and difficult and sometimes stressful. So we really try very hard to make this entire process, from you scheduling, from you coming in for your evaluations, having your surgery, all your post-operative care, as smooth as possible, because we have so much control over the process with our small clinic and our in-office surgery suite.